going to pivot, but really it's in the same spirit of what we were talking about. So Katie and Bianca and I were talking about implementation practice and the role of implementation support practitioners. And it's really aligned with this next topic, which is, are relationships as important as strategies for successful implementation of evidence-informed programs and practices? So Annette Boas and I are going to kick this off with a short input from some research we've been doing funded by the William II Grant Foundation that has yielded some interesting findings on this exact question. And then we're going to move into our fireside chat with some folks that provide implementation support and hear directly from them about that. And that's Sue Kearns and Bob Franks and Carrie James and Jennifer Boss. So really excited for the second half of our time together. And I am going to turn it over to Annette Boas, who is going to kick us off by doing a little stage setting as to maybe even why we cared about this topic or started this research project. So I'll hand it off to you, Annette.
Thanks, Alison. So I'm going to cast your mind back to 2018, when you could sit in a cafe with a colleague from a country many thousands of miles away and discuss what you thought needed fixing with the field you worked in. So Alison and I were sitting in Washington and then a little later in London, talking about why we thought implementation practice hadn't really helped as we hoped it would close the gap between what we know and what we want to do in terms of delivering better services for the community. And as we sort of talked around this issue, one of the things that we kind of stumbled upon was how much of the time we spend in our implementation thinking concerned with very practical tools, checklists, protocols, guides, plans, models, frameworks, lots of very practical and functional ways of thinking about how to solve problems. But whether these things really were helping us make that step forward in terms of actually making a difference. And when you ask people around about toolboxes, what they have with them when they go out to do work, the models and frameworks we use, ask them where the people are, they say everywhere. But then they go in and look and say, or maybe they're nowhere. And so what we started to do is think about how we surface where people are within our implementation work. Much of this complements really nicely what Katie, Bianca and Alison have been talking about before. But the particular lens we brought at the start of this work was we were trying to think about whether it was really possible, as many people have been commenting in the chat, to do implementation work more co-creatively. And when we started having this conversation 2 or 3 years ago, it sounded like some of the most idealistic kind of planning and thinking that we might have done. Could implementation practice become more co-created in terms of what it looked at, how it worked, and actually how we made change together? When we look back to see what was there already, we found really a lot of the work that's around people is, as again somebody's highlighted already today, is really around leadership. And leadership is a big part of how we've conceptualized implementation and is a very important part of the kind of factors you have to have in place for change. But there was much less being written about and thought about what it really meant to build relationships to support implementation and how that sat alongside the very practical tools, checklists, protocols that people were using in their work. So that's what we set about to look at in this work. And Alison's going to take you through some of the findings that I'm not sure we've shared before. So a very exciting opportunity for me as well. Here, Alison presents where we've got to with that work. Hand over to you, Alison.
That's great. Thank you so much, Annette. So, so these incredible conversations we had resulted in a proposal to the William II Grant Foundation. And it was really, as Annette said, we were kind of focusing on how we can do this work more co-creatively. So we wanted to study a few different things. One was to get a sense of what were the strategies that folks providing implementation support were using, specifically in public child welfare systems, more broadly in systems that deliver services for children and families, and how they were using these strategies to support evidence use. But we also were really curious about whether or not the individuals doing this work thought that engaging stakeholders would strengthen those strategies. So we asked them about, how they approached engaging stakeholders, what results yielded from stakeholder engagement, and whether or not they felt that developing those relationships with stakeholders would strengthen any strategy that they were using. And then really getting specifically into understanding the role that relationships play generally in supporting effective implementation. So we have conducted a series of in-depth interviews, and actually the people as part of our fireside chat participated in those interviews, and it has been an incredible journey. And we chose the people that participate in the interviews with some criteria in mind, and wasn't just providing implementation support and helping to use evidence-based practices in real world settings, but also folks that had been doing this a while. So I'll call that out, that we've all been at this a long time. Bob, that makes me laugh. I know we saw each other at the D&I conference last year. We were like, how did we become old here?
We're the old guys.
Exactly. But because we wanted to get a sense of what implementation support practitioners themselves had learned in their journey to help others implement. And that was an amazing part of these interviews. And we also have recently administered a survey where we're trying to confirm, because we've interviewed a small number of people and we're trying to kind of think, are these findings generalizable? So we've launched a survey with institute participants, so folks who participated in our summer institutes in this virtual series via email and social media to explore whether the emerging themes that we're finding in fact are resonant with a larger sample. So we're going to present a little bit of that. And I wanted to just flag that we see this as food for thought right now. So we, as Annette said, this is our first time presenting these findings, and we have some rigorous analysis ahead of us. But right now we're just sharing with you some things that we're noticing. And we want you to join us in those observations and help with some sense making. So one of the first things that really stood out for us in the interviews in particular were that we asked about those three topics I just named around the strategies that people are using to support implementation, to support evidence use, whether and how they're engaging stakeholders and what that work looks like. And then also the role that relationships and trust play in supporting implementation and evidence use. And what was really striking was that there was quite a bit of breadth and variability around what people said related to implementation strategies. There were some things that were commonly discussed in terms of conducting needs assessments, focusing on fidelity monitoring. There were a handful of strategies, but really just a handful. When across the interviews, there was breadth in what people said. And we noticed that variability. And it wasn't that the strategies people mentioned weren't common strategies, but there's a lot of individuality in terms of how people approach the work. As we talked about stakeholder engagement, the findings actually started to become a little more similar. People started to say similar things. They talked about a sequencing that was needed when they engaged stakeholders. They talked about how critical it is to establish credibility, to demonstrate value, to demonstrate humility, to build trust. They talked about specific strategies around deliberate communication, addressing power differentials, what we just spoke about earlier. Those things were commonly talked about. And then as we got to the question of relationships, the responses were deep and uniform. So there wasn't anyone that talked about implementation support that didn't talk about how critical relationships were, but also there was a lot of similarities in how people described how they build trust and how they know when they're in a trusting relationship. That was so striking to us that as we moved through the interviews, we really kind of caught fire, if you will, around the relationship questions. And we ourselves began to wonder, boy, this is not a well-researched area in implementation practice in particular. There's a lot of focus on strategies, which are important, but there are less questions around the relationship aspect to the work. So we know that, again, relationships were seen as absolutely critical. You know, in many ways, folks kind of talked about this as not just a important factor in the work they did to provide implementation support, but in many ways, I think those of us analyzing this qualitative data would say, folks kind of talked about this as the important factor, that without relationships, it was really hard to implement any strategies. And so that was, you know, an important first finding for us, and has led to us asking some, you know, critical questions around whether building relationships is a strategy in and of itself, or if it's the strength of the relationship is what kind of moderates how impactful other strategies are that you're using. We think those in fact are really important research questions. So just peppering this with the survey that we've had out to institute participants. So many of our participants are folks who provide implementation support. I will say probably about 20 or 30% of our respondents do categorize themselves as implementation researchers. So that's interesting. And when we pulled researchers out, the findings kind of stayed the same. So that surprised us a little bit. But again, early days, we only have about 100 responses, and I think our universe of data could be about 900 people. So that survey link is still open, and we will be sending that out in the chat so folks can keep responding. But we know that over 90% of our respondents agreed with the statement that relationship quality between an implementation support practitioner and those that they're working with at an implementing site is critical for long-term success. Seems like an obvious thing maybe, but we wanted to confirm and affirm this finding that we had in the interviews, that relationship quality was seen as absolutely critical to the work. And this gets back to how it is that we build competency of a workforce, that it is more about more than tools and frameworks, that there are relational aspects to the work that cannot be overlooked. The other thing was interesting is that we had a statement in there where we asked the extent to which kind of people could fill in the blank in terms of their level of agreement. So that relationship quality between implementation support practitioners and the service systems they're working in is blank than the specific implementation strategy selected. So is implementation, is relationship quality more important than specific strategies? Is it somewhat more important? Is it no more or less important? Or is it that the strategies are more important than the relationships? And interestingly, again, with these folks that have responded to our survey, about 70% thought that the quality of the relationship between the ISP and the implementing site stakeholders was more important, either much more important or at least somewhat more important. And again, food for thought. It's an interesting finding in that, and really affirms what we were hearing in the interviews. So something that came up in the interviews when we asked about building trusting relationships was often what people talked about in terms of the strategies they used to build trusting relationships. Strategies were often indicators of what a trusting relationship looked like and felt like. So for example, people might talk about demonstrating vulnerability as a strategy for building trust. And also when asked about how do you know you're in a trusting relationship, the respondent might say, because we're demonstrating vulnerability. So there was some conflation, but also it was just a really interesting finding that the strategies for building trusting relationships are often also the same indicators of the trusting relationship. And there were a few things that really stood out there that we're going to highlight. So we asked people that question about how do you build a trusting relationship as part of your implementation support practice. People talked about demonstrating humility. So it was very important for folks to talk about entering the implementation space as humble, as a co-learner, as recognizing themselves often as an outsider to the work. So that was talked about a lot, and it was very striking and compelling. Folks talked about how important it was to be honest about, funder goals of the project, what was likely to be achieved, what might not be achieved, to really demonstrate credibility in knowledge with the implementing site. So really being honest and showing credibility were things that came up a lot. Responsiveness. So folks talked about being nimble and being able to respond to emerging needs of an implementing site. And I think that one of the things that struck us in doing these interviews is, honest to gosh, how many hours implementation support practitioners work. Because there is the implementation project that you're often funded to do. And then there's lots of adaptive issues that come up, lots of shifts in resources, little minefields that you kind of have to work yourself around. And the responsiveness of the implementation support practitioner to all of those things seemed to matter a lot in building a trusting relationship. And then commitment, the ability to demonstrate resilience and demonstrate long-term commitment in the face of implementation challenges that are inevitable in large service systems. So those themes were really resonant to us, and it was honestly, and so I'm excited about the chatting with folks in a moment here, it was like a master class in implementation support, because the folks that are talking about this are the same folks that understand, yes, we need to build data systems. We need to be able to monitor and improve fidelity. We need to be able to look for benchmarks and outcomes. And, we need to be able to put communication protocols in place. Technical skills were talked about quite a bit by our participants as well. But equally talked about were these relational skills. And again, that seems to be a piece of the puzzle that's not often talked about. And along the bottom, you'll see these three words: authenticity, vulnerability, and empathy. And those were the three things that came up so much as both drivers of a trusting relationship and indicators of a trusting relationship. So folks might talk about demonstrating vulnerability and then acknowledging when a stakeholder at an implementing site is also showing vulnerability, acknowledging that vulnerability, creating a safe space for it. And then a lot of the work happens between this kind of reciprocity between the implementing site stakeholders and the implementation support practitioner, that they show vulnerability together, and through that work there becomes even more implementation progress. And it aligns itself well with the concept of empathy that was also discussed a lot, which is not only, yes, being able to take someone else's perspective in a situation, but the idea that demonstrating empathy really supports growth, and that you need to have both the implementation support practitioner and the stakeholders at the site. They're both equally growing from the relationship when they're equally demonstrating empathy for each other and the perspectives of other stakeholders in the work. So that came up a lot, and there's some really nice clinical theory that would support, vulnerability-based trust and modeling that. There's a lot of relational theory that would focus on how critical empathy is for outcomes. And I think we all know that's one of the things we seek to in stakeholder relationships is empathy for one another's perspective. Evidence of a good relationship, people talked about transparency, that the site itself demonstrates transparency, especially when things aren't going as well. They're more likely to share that information. That there's a sense of mutual accountability between the implementation support practitioner or team of support practitioners that's doing the work and the site itself. That the implementing site demonstrates a comfort for asking for help. And both the ISP and the stakeholders demonstrate a capacity to stay in difficult situations. That came up a lot, that fifth one, I have to say, was mentioned a lot. Staying through the hard conversations and being able to manage healthy conflict came up a lot in those interviews. Again, just really amazing comments. So I'm going to turn it back over to Annette, who's going to offer some thoughts around some implications for this work, and then we'll move into talking to our panelists.
Thanks, Alison. And just to say, Amanda has put the work kind of blog rather than the paper stage of this work, and has put the link to the blog we've written with some early reflections on the work in the chat. So, I mean, I imagine you can already see that there are some real implications for implementation support here. And the most obvious are probably the workforce. So how do we actually support professionals to develop more relational skills alongside technical skills so that they can really feel well equipped to do this kind of work? Or imagine, as has happened in kind of wider evidence circles, how the kind of more relational skills are gained is on the job, is over time. And so that's not really the most satisfactory way when people are starting out in their career, and we can teach people how to do this work well. The second element in terms of support is about how we might create communities of practice or networks to really support people doing this work, to learn from each other. We know a lot of this learning comes from where we come together and have opportunities to chat through the problems that we're facing in our work and to hear others' perspectives, and how we actually build and resource the infrastructure to allow people to engage in those opportunities to learn from peers. And then the other kind of implication I wanted to flag up, I guess, is more around the research that we do in this area as well. So our research gaze has tended to focus on those tools, those checklists, those protocols, and how well are those being implemented, how well are frameworks being adhered to, and not on actually how are the people who are doing the work engaging with it. And so we might collect data on that as part of our studies, but it doesn't tend to be the main focus of what we've looked at in implementation science. So it throws up some really interesting challenges for how we might actually, back to what I was saying earlier about start to close this gap between what we know and what happens in practice. Some of that might be better understanding and supporting and growing this more relational approach, and helping people do that better and see the value of it actually, because as the kind of work that Alison and Bianca and Katie were mentioning earlier, you know, if we're valuing things and showing people how important it is, it makes it so much easier for people to carry on and do the work. And just finally, I'll just flag up what Ali put in the chat, which is about actually how do we, given how important it seems to be the kind of relational aspect of doing implementation work, what does it mean to take so much of that online? And we know that it's been really hard to grow some of this kind of trust and these relationships online. People have been doing it, but it's extra challenging. And so there's some learning for this work too, I would agree, coming from that particular challenge, particularly as we're likely to be doing more of that in the future as well. That's it for me. So
that's awesome. Thanks so much, Annette. I'm gonna stop share and let our folks come online here. So again, we have Sue Kearns, Bob Franks, Jennifer Boss, Carrie James, some folks who've been working in human service settings for a long time and supporting evidence-based practices and just change generally in these service systems. And as I said, absolute experts in all of it, right? The technical skills, the data-driven piece, the creating fidelity, monitoring checklists, all that good stuff. But also have just amazing insights around a lot of what we're talking about now. So before I jump into some questions for this group, I just wanted to know if you had any kind of opening thoughts or just some reflections on anything that we've just said, anything that kind of stood out to you that you might want to just comment on.
Well, hi there, Alison, and greetings to everyone around the globe. I'm so happy to be able to join you. I do have a quick reflection. I was excited to see the findings, having had the opportunity to speak with you and your team in our conversations some months back, being able to see that my colleagues in the space shared some of my thoughts and sentiments was refreshing, right? Good to know that I'm not the odd duck out there. I don't know that, and I think I discussed this when we met some months ago. I don't know that I have thought about the way in which I have done this work over the past number of years as sort of a standard for practice. It's much of it is what, you sort of stumbled through and you figured out. And so much of it, as I reflect on where I was when I began this work and where I am today, has shifted in my thinking about what I may have initially seen as a sort of core primary driver or approach, and what I think today, in terms of what I lead with. So really excited to see that there was similarity in terms of thinking, and more curious to see and to have discussions around how we potentially look at some of those areas in terms of research that we haven't traditionally looked at, right? Like how can we dig into understanding more about the way in which we support some of the more adaptive aspects of the work as opposed to the technical? And there is, a gap. That is definitely an area where you just sort of feel your way through. And I'm definitely, interested and curious to learn more and to engage more in that.
Yeah, absolutely. I love that point. Yeah. How do we understand more about how implementation support practitioners address adaptive issues? Because that is, when I said the hours everyone was working when we were interviewing folks, and it was just unbelievable how much goes into providing implementation support. It is more than developing checklists, and
absolutely,
that is absolutely such a nice reflection. Does anyone else want to just offer a reflection at this point?
Jump into the questions.
I'm jumping in, Jen. All right. So the first question is something that we had asked you all, and would love for all of these people to actually hear your comments about this. Is what role do relationships play in supporting implementation and supporting folks to use evidence? And we always encourage, when you're thinking about that, to think about that from multiple perspectives. Your perspective in terms of how important relationships are, but also, what do you think the perspective is of those you're supporting to do the work? Like, what would they say about the relationship piece? And so, I don't know, Jen, if you want to kind of take that and run with it.
Sure. And I'll echo what Carrie said. Thank you for including me in this amazing panel, and being a part and hearing all of the information that you all have been sharing. It's really exciting. And for me, I would say, I work at 0 to 3, which is a national nonprofit in DC in the United States. And our mission really is to ensure that all babies and toddlers have a strong start in life. And a core principle for us is sort of encapsulated in a phrase that was coined by one of our funders. And the phrase is, how you are is as important as what you do. So how you are in relationship with others, how you enter into a space with others, how you carry out the work with others is as important as the things you're doing. And that's really sort of the core principle of relationship-based work. And so I think that when we are we're all in these sort of human service spaces. When you're doing implementation science work, you're really working with human beings to implement the practices to make a difference, usually for other human beings. The way that we carry that work forward is through human to human relationship. And, that sort of gap sometimes that we see between what we know in the science and what's actually happening on ground in practice can be sort of bridged by a person who enters into that space through relationships to help bring that science to the practitioners. So I think relationships, we always use terms like it's the core, it's the heart, it's central to what we do. And I think, that just makes its way through all of our work.
Yeah, I love that, Jen. I just put that in the chat. I think I missed a word though. So if someone's tweeting that out. How you are is as important as what you do. Thank you so much for that reflection. I wondered, Carrie, if you wanted to say a little bit more about the role of relationships in your work. I know you have so much, from philanthropy to the Gateway now, and your own consulting and public systems, and just thinking about that.
Yes. So, and I'd alluded to this a little bit in my earlier comments. When I just think about the roles and the way in which I have had the great opportunity to support change efforts, particularly in public child welfare over the past 19 number of years. So odd when you add that up and you actually say that publicly.
Yeah.
20 plus years is sort of crazy, but but really having had the opportunity to wear so many different hats, from from TA provider, from leader, consultant, and I think what I know today, and not to be hokey, but relationships is really core. It was fundamental, and I think in child welfare, where so much of the work, everything is rapidly changing, and yes, we're bringing in, we want to use evidence-based practices, we want to be data-driven, we want to be data-informed, but there are so many other contextual factors that go into how change happens in systems. And what I think we're really good at in a lot of our systems work is the technical stuff, right? I think we've gotten so much of that down today, and there still is definitely room to fine tune. But the adaptive stuff is really what I think continues to plague us, and in large part is what continues to be our greatest challenge in being able to see, a full vision of a reimagined system, or systems come to light today. I think in being effective, being able to be vulnerable, right? Being able to engage and building that trusting relationships is absolutely essential for both leaders, practitioners that are going to be continuing the work long after you're gone, to buy in, to be able to be, sort of open and honest and authentic about what's really at the root cause, what's keeping success from happening, what are those hurdles. And I just don't see how you can even begin the dialogue really with any level of depth without having a solid relationship in place, and an approach to continue building that and strengthening that as the work continues.
Yeah. Yeah, you have a lot of agreement there, Carrie. I know in the chat too. I think this concept of our role in helping service systems navigate the adaptive issues that will come up. And that is something that we're not teaching our students, we're not often building capacity around, and it does take, in many ways, a bit of a different set of skills and a self-awareness, and the humility, and and in many ways too, it's why, as I noted earlier, we were selecting folks to interview for the project, we really wanted folks that did have a lot of experience, because you almost learn to become humble. It's not something that you might know when the minute you start this work and you come in with your EVP and your framework and your 80 PowerPoint slides on how this is going to all happen, and then you realize, oh wait, there are people in here and not everyone's and it's a totally different ball game.
And it's a totally different ball game.
It is, and it's easy to say the words. Relationships are important. Relationships are at the heart of the work that we do, but it's a practice. It is a practice that takes time and effort, and making mistakes, and building those skills, learning to be humble, learning to ensure that you're building trust with the individuals that you're working with. And it's not like you can switch a light switch on and say, okay, now we're relationship based, because relationships are important. It is work and practice.
Yeah, absolutely. I'm going to turn to this question around trust, because that was kind of people talked about relationships, they talked about trust immediately. And I'd love, Sue and Bob, for you to talk about the role of trust, how you build trust, how you know when you're in a trusting relationship. Like, how does that happen in your implementation support work? And happy for either of you to start.
You want to start, Sue?
Sure. I mean, I have been thinking about this a lot because, you know, it's almost like when you are in a trusting relationship, you know it, and thinking about how do you actually operationalize it, and what are those features of it, and is it reductive? Is it possible to kind of operationalize that, or is there more collective complexities to these relationships? One of the things I think about a lot in my relationships, and I saw it somewhere in the chat, and it's pretty active, so I can't remember where it is at this point, was a reference around the clinical work, and I think I reflect a lot on my training as a clinical psychologist, and how you build trust in therapeutic relationships really does translate over into a lot of the implementation work that we're doing as well. And for me, I really do think about, like, how do you create shared understanding, and leading with that? And do you have a shared understanding of what the problem is? Because sometimes you go in and you think, okay, our problem is, how do we implement the CBP? But that's not actually the problem that the organization or the agency is struggling with. And there might be another core issue that has to be addressed first. And so taking that time to really establish that shared idea of what the problem is, a shared idea of what the solution is that, you know, the solution really truly, does everybody agree that that's where we're headed? And then is there a shared understanding of the steps it takes to get there, right? That bridging piece. And that's where our strategies and our our implementation supports and frameworks, you know, they kind of intersect with this trust of, like, okay, we're going to go, we have this problem, there's this thing we want to solve, we have these strategies but we're in agreement, right? That these are the things that we're moving forward on. And then I just wanted to say too, I think really taking that time to build a shared understanding of what the risks are involved in doing this work. So to me, it's a little different if you're bringing in a new program that doesn't exist already, right? It fills a known gap, right? In service delivery, something like that, versus a program or an intervention or an innovation that is designed to do practice change. Because practice change, maybe deep inside, some people feel like it sends a message that what they were doing before was wrong. And that can eat away at a trusting relationship, right? And so really kind of understanding where people are coming from in the beginning, in that risk. And I just want to say one more thing, and then Bob, I want to turn it over to you. But I think sometimes when you come from outside, and I saw some nice chats about this too, about internal versus external implementation supports. But when you come in from the outside, you don't always appreciate the risks that some agencies take. I'll give an example of a child welfare, state level child welfare agency that we were working with, and we were talking about doing a survey of their workforce to better understand how they understood the role of evidence-based practices for children in the foster care system. And the risk was that, what if their workforce doesn't actually know much about how to do that? And then we have to say something about that out loud. And that's really vulnerable, right? And so if I didn't have a shared understanding of what that risk was, we could ask questions in ways that could really increase the vulnerability of the agency. And so taking that time to have those conversations was really critical. So I'll stop there. Sorry, go ahead, Bob.
Well, that's great. You know, I've had the opportunity to work with Sue before, and it's always wonderful to hear her speak, because sort of as Allison has pointed out, a lot of us come at these issues in much the same way. I think I have over 20 years as well on the odometer, and when I look back over the things that have been successful and the things that haven't, and when you look at your failures and the failures of initiatives that you've been involved with, a lot of times it does come back to this issue of relationships and trust. So you can have all the expertise in the world. You can use models, you could use tools. But at the end of the day, if you don't have the trust of the people involved in the initiative, in the change process, you're not going to be very effective. And I've certainly seen that many times. And I think the example that Sue gave about, therapy, if you think about the human services role, is a good one. You could have a clinician who's trained really well in clinical skills, but if they don't develop a therapeutic alliance with their client, and there's a lot of research that shows this, they're not going to be effective. And it's very similar. I wanted to comment on really two things, building upon what Sue said. I feel like when you're an implementation in an implementation support role, and sometimes it's sort of like you're conducting an orchestra, and there's lots of different people involved at different levels. So you have your funders, you have your systems people, you have your community people, you have the people who are the practitioners, and then you have the people that are going to be impacted by what you're doing, the families, the children, whoever you may be serving. And it's really hard to pay attention to all of that while you're conducting the orchestra. And part of it is to figure out how to get those different components to really speak to each other, to be able to create sort of this beautiful sound together, but they all may have their own needs. They all may have their own perspectives. And so when you're working with the funder, you have to really understand, what the funder's needs, what their worries are, what their concerns are. And the place to start is really from that place of humility, of developing shared understanding, of listening. And I have to say, one of the biggest things that I would encourage anyone on this call to do if you want to be effective working in the implementation field is learning how to listen well. If we come in with our prepared PowerPoints and our presentations and all of our, strategies, and we don't take the time to first really listen and understand, as Sue said, what are the underlying needs? Maybe there is this overt issue, but what's going on underneath the picture? And then sometimes there might be issues between those groups. So there might be challenges between the funders and the systems people and the folks in the community. And part of our job is to try and come up with this shared language, to extend the metaphor, this sheet music that we all can play from together. And I think that's one of the biggest challenges, that we have, using those things like, we said, listening, being humble, being responsive, really trying to understand what the motivations are and not being overly rigid. Someone wrote in the chat this idea of how do you walk the line between, really doing this work while at the same time needing to have your expertise and come in with the, what you have to offer. Well, you're never going to get to what you have to offer. You'll never be able to utilize your expertise if you don't first find that sort of common ground that you can talk on. The last thing that I'll just say very quickly is that hasn't been mentioned yet today is that all things don't have to occur in one person. So most of us work in teams, and what's so exciting about this work that the folks have done today around these competencies, which I love, because a lot of times we kind of just knew or had a feeling about what we look for in an implementation professional. It's so great to have that quantified in some way, but we're not going to get all those things in one person. So we might have someone on our team who's really good at building relationships. And we might have someone on our team who's really, really good at using data-driven approaches and using implementation tools and strategies. And if we can learn how to work together within our teams, we can round out those strengths so that we can figure out how to best be effective when we're doing this work. So.
Oh, let me tell you about the active listening. Everyone's amen on the,
Yes.
there's a lot of amens on the chat. So Jen, I know you wanted to jump in.
Yeah. Well, I wanted to say amen to everything that both Bob and Sue said, and also to add, in addition to the effective listening, is getting comfortable with, this is related to humility, getting comfortable with the idea that not what someone may do in terms of the implementation of the strategies may not look exactly like what I would do. Like getting comfortable with space for seeing different ways of getting to the end result, and that requires a lot of humility on the part of the experts.
Oh, Yeah, I mean, do you guys, I'm gonna cry, Bianca. People that know me know I'm gonna start crying. This is why we wanted to do this session, and it's just like everything you guys are saying are things that we're not talking about in implementation science enough. Do you guys have any kind of last thoughts? I was gonna invite our other speakers in for some kind of final Q&A, and I just didn't know, Carrie or Jen, Bob or
I
Sue.
just wanted to call out that there was a couple comments in the chat that I just wanted to highlight the importance of, even if we don't get a chance to really dive in. People really talked about the issue of, you know, unconscious bias, cultural humility, the role of culture and context. I don't want to not give enough attention to those issues because they're so incredibly important. We've been doing a lot of work with our team around unconscious bias. And I think it's really important that we're, you know, in this role that we are, where we are trying to conduct the orchestra, where we're really thinking about those issues of culture, context, race, you know, advantage, all of those things that we really have to think about and have forefront in our work. So I just wanted to highlight that, even if we don't talk about it in depth today.
Thanks, Bob. Any other thoughts people want to say before I move us along? I want to give you guys the space. People are going crazy in the chat. So
I might have one addition, let me put it this way, because I think the conversation was probably pivoting it a bit towards, there's the relationship over here and there's the expertise over here, and we think it's important to really invest over here. But I just want to say, I wouldn't underestimate the power of being able to walk the talk and really come in with your expertise and show people how that might unfold in complicated practice settings, and use that as a channel to build your trust and build your relationship. So I also think there's quite a bit of interconnectedness between coming in with all your professional carry-on and use that for trust building and relationship building.
yeah, it's so interesting, and I think it is. It's this line, and I think Bob and Jen were talking about that. You know, in terms of demonstrating humility, listening, knowing people might not do it your way, but also you're trying to be supportive and bring in the pieces. And so, yeah, I totally understand what you mean, Bianca. It's kind of like having credibility, having expertise, and being a good listener, and, you know, not being so wed to form sometimes, and, you know, all sorts of things. And it's a really important line to walk. If folks want to come on, everyone from the panel, one thing I wanted to ask, and we're kind of getting at it here, if maybe everyone didn't kind of pick up on some of the kind of implicit aspects of this conversation today, is that there are some folks in the field of implementation science who have observed a bit of a growing divide between implementation research and implementation practice. And transparently, I have a bit, and we're really interested in folks' thoughts about that. And so we're going to go to the Q&A in the chat in just a moment. But if any of our panelists, I know Bob and Bianca, you had mentioned being fine to talk to that question. If you guys want to jump in, and anyone else, maybe we'll spend just about 3 or 4 minutes on that, because I'd love to have a solid 10 minutes to get to this Q&A. But are you observing that, and do you have any thoughts about it, I guess, is the question.
Bianca, do you want to lead?
Yeah, so I would say yes. I think I can observe that there's this enormous productivity in the science space, and at the same time, very little transfer of whatever is developed over here over to the practice space. At the same time, I'm probably also thinking a bit, well, it is what it is, because this is science, this is practice. The ways these two systems function, the rules, what is an incentive and what not, the behaviors expected, the priorities set, they're very different. So is it realistic if we just wanted to close that gap and really find a way of bringing them closer together, is it realistic to expect from practice that they will consume tons of research in the future, or vice versa? Will scientists be really interested in getting their hands dirty in practice? Likely not, because over here you acknowledge paper writing and funding amounts. Over here, you acknowledge helping clients. So in that sense, I think there is a bit, for me, it is what it is, because they're two different systems. But at the same time, talking about implementation support, I think the concept of intermediary organizations, having these bridge builders who are able to kind of dance this dance and probably also take a third step into the policy system at the same time. Yeah. That's where I would see some perspective for this. And but that also makes me less worried, because I think there's a solution to the problem.
I'll jump off from there. I think, sort of having lived in this intermediary organization world for a lot of my career, with the goal being bridging the gap between research and practice, it has been really interesting to watch from the very early days of what we called sort of implementation practice, implementation science, to where we are now. We are seeing, I think, that divide grow, and implementation practitioners say a lot of this stuff that they're presenting at a conference or writing about in journals isn't really relevant to me. And a lot of the researchers are saying, oh, all that stuff those implementation practitioners does, it's just sort of soft. It doesn't really have any science to it. It's all mushy. And so, we've worked hard to try and think about how we can have both the science inform the practice and the practice inform the science, which is really ideally as it should be. But our structures and our systems, the very things Bianca alluded to, sometimes are the barriers themselves. So if the only people writing about this are people who are actually doing the sort of quote unquote hard research, and that's where the funding flows. So if national organizations or large funders are saying, well, we're only going to give you money if you have 3 peer-reviewed, articles on this topic, then that further creates that divide. So, one potential challenge is that we really think about working in partnership, and that we really think about trying to create those relationships whereby, for those of us that are implementation practitioners, we're really working collaboratively with implementation researchers and vice versa. And that when we, perhaps if they're not even an integral part of our team, we think about how to do that. And I'll give you one very brief concrete example of that. We were for years doing readiness, and we were doing it in a kind of a soft way where we were assessing readiness. And I know readiness is a concept not all of us like, Allison. We ended up working with an implementation researcher who had a very structured tool, and we began using that in our practice. But there was an iterative quality where we were able to adapt that in a way that worked for us. And so that's just one tiny example, but I think there are ways that we can actually work together. But I think this is something that we need to pay attention to as a field.
Thank you. I'm going to turn it to Christine now, Christine Andrews, who's
oh my gosh.
Yeah, so go for it, Christine. I know the chat is wild. So I will ask, Christine is going to moderate. If we can keep all responses to less than a minute, that would be great. That would allow us to get in 5 or 6 questions. So please jump in. Don't be shy. Take yourself off mute. I'll be quiet. Christine, go for it.
Okay, great. Thanks. And you're right. The chat is all over the place, and it's hard to pick just a couple of questions. I'm thankful Bob brought up kind of the conversation around equity, adaptation, bias that was going on, and hopefully we'll get back to some of those. One I want to bring up now is around funders. So, we're having a lot of discussion about the importance of relationships and trust, and the trust building and the necessity of that. This question says, how do we get this information to funders that relationships and trust are critical to success when funding 1, 3, 5 years without the space to build relationships first?
Well, I'll take a stab. I don't know. I'll jump in, and and I'll first say, I don't know for sure. But I'm thinking about just particularly from a public child welfare perspective and from a leadership role there, right? And particularly knowing that so much of the work, at least in the jurisdiction that I worked in, was, you had to engage with your legislatures, right? And you being able to build relationships with them, right? To build the strategic patience, right? In child welfare, when we're looking at child and family outcomes, people want immediate response or have a belief that like we need to do something today, right? There's an issue today, and we should be responding immediately, but that takes time to show up in the data. That takes time to show up in the outcomes. And I think a takeaway or a lesson learned is really the importance of having to build those relationships there with your legislatures, with your folks who are going to be, either coming for your funding or supporting your funding and giving you some room and giving you, that cover. And a lot of that is the language I use around those contextual factors that I think, when you show up on the scene as that practitioner, as that consultant, and you're showing up with your 80-point PowerPoint presentation and slides and you think you have all the answers. These are those contextual factors in the background that fundamentally impact whether or not that work thrives and grows and doesn't. And so, and that's tricky because there was so much more in that process around politics and navigating that again is just what we don't talk about, what we're not trained on, what we don't have a roadmap for. And so like I started, I don't know, but those are many of the things that I discovered along the way and think we need to strengthen how we do that better.
Thank you. Annette, did you want to jump in as well? I saw you took yourself off mute.
I agree that funders are incredibly important, and I actually think they probably would be interested in ways to improve the effectiveness of implementation, and this is a well thought out, some well thought out pieces of work that can help with that. I work on evidence implementation generally with funders. They are, I guess, rather surprised that people don't come to talk to them more often about what we're learning and how that would feed in. So I think there is an opportunity there.
Mm.
Yeah, I'll try to squeeze in another one here. Thank you. So considering the importance of trusting relationships, how can we best bring families, the direct recipients of these interventions, into these implementation processes?
I'll jump in quickly and just say I love that question because families that sort of the end user they're often left off of the table, left away from the table in the conversations about the work, and being engaged not just at the sort of end receiving end, but really engaging parents right up front. So, really when you're working with sites who are, implementing practices that impact parents and children, parents should be right there at the table talking about those interventions. Parents should be right a part of those conversations that where they can bring the parent perspective, because if we're walking into this space and into this work with a sense of humility and recognizing that I don't know your lived experience like you know your lived experience. I am not the expert on that. And your lived experience is what I need to understand, and we can understand together in order to affect change, the change that you want, the change that's going to be create success for you in this program, in this space. Parents are a part of that conversation always and should be right there with us at the table.
Right.
I think there's a space to bridge what Jen was just saying with the discussion about funding as well, because I always try to involve family members or folks that are going to be impacted by whatever implementation strategies we're working on to the table. But I think it's critical to recognize that a lot of us it's our jobs to do that. And we ask a lot of families to volunteer their time or their perspective. And it can be a really vulnerable experience for people who've gone through this. And so building that into your project in the beginning, asking for funding so you can pay the family to be there, for example, so that they're acknowledged at the same space as the other folks who are kind of more implied getting paid to be there in the moment can be really important, and kind of creating a level playing field. And we've also spent a lot of time kind of, providing additional resources so that families can authentically participate, strategic sharing, trainings, and other things, so they don't feel like they have to just kind of share their stories over and over again, in ways to help the implementation team. I think those are important things to think about.
I don't know, Christine, what do you think? Should we try and squeeze one more in? I'm worried about just the 2 minutes left.
Yeah, I don't have I'm not going to squeeze a question, but I do want to squeeze just a very important comment that several people kind of echoed and said amen to, right? And that is just the need for kind of implicit bias resources, and resources and tools of just navigation and adaptation for some of this conversation we've been having around relationships and the tensions as you think about implicit biases and identities that folks hold. So there's just a call for the need for that. And I'll just leave it there, so that we can close out properly.
Thank you so much. And that actually, it just got put into the chat. I hope people take a look. It builds on what Christine just said. On January 28th, Thursday, January 28th, 10:30 a.m. Eastern time, we will be having another virtual session, and it will be on equity and implementation science and urgent partnership. We have incredible speakers lined up for that. I can't name them all now, Anna Bauman, Corey Bradley, Ruben Para-Cardona. I mean, we have a list of people giving absolute thank you. Keep putting in the chat, Amanda, 5 times over. Please join us, Equity and Implementation Science and Urgent Partnership, January 28th at 10:30 a.m. Eastern. We will be here doing this type of panel discussion, and we hope to be able to cover those important topics that were in the chat today. So I think the other thing I just want to say is when we share the registration link here, we will get it out to everyone. I think we're getting our registration page up and running for that. But it's going to be amazing. We have the right people for that conversation, and we can't wait to bring it to you. And I am so deeply, deeply grateful, Annette and Bianca and Christine and Sarah and Todd and Amanda and Lemma and Sue and Bob and Jen and Katie and Carrie. Thank you so much for this. This was amazing. We kept a lot of people on for a long time, so it was amazing.